So, Jim, you're up.
Okay, well, we're getting the slides up. My name is Jim Fell. I also work at the NORC at the University of Chicago, an independent, not-for-profit research center. I like to call it National Opinion Research Center. They stopped using that name for a while, but it was established in 1941, so that's how long we've been in existence. We mainly do surveys, as the title would tell you, but also a lot of evaluations of public health programs. I have no conflicts of interest, and nobody has funded this presentation or anything in it. It's a summary of my opinions anyway. But I have been funded by the National Highway Traffic Safety Administration, the AAA Foundation for Traffic Safety, the Insurance Institute for Highway Safety, Robert Wood Johnson, NIAAA, and so on. If you can think of any other funders, let me know. Okay. Now, I know you heard from Doug Biernes about this TRB workshop where we had experts assemble. We talked about 8 different strategies, and then we had everybody vote for their top 3. And I am going to talk about the top 3, but I'm going to mainly talk about the barriers to implementation, why we can't get those 3 measures implemented. And I'm also going to go into, at least peripherally, some of the other programs that we did look at. So yes, the workshop was in 2015, and by the way, there is a publication from Traffic Injury Prevention which describes the workshop, and is it in the book? Okay.
I can see it.
All right. Okay, these were the 8 strategies that we talked about. Now, these were considered, at least by the 26 experts at this workshop, as either strongly or moderately effective, evidence-based. Increase alcohol taxes. There's been, of course, a lot of research on that, and it shows basically you increase the taxes, you increase the price, you increase the price, you reduce alcohol consumption, you reduce alcohol consumption, you reduce the consequences. There have been a few studies that shows that when the tax is raised, motor vehicle fatalities go down. But it stands to reason that if we do that, that's going to have an effect. Re-engage the public was the second strategy, because as we know, the public really isn't engaged anymore. They used to be in the 1980s when MAD was at its peak and getting the public's attention, but there are all kinds of issues now the public's concerned with, not the least of which is other drugs, drug driving, cell phone use, distracted driving, now drowsy driving, which just had a big press release. So there's all kinds of things. And when you ask the public if impaired driving, alcohol impaired driving is still important, they say, yes, it's still important, but there are other things that are more important. So we are losing the public on this. Lowering the illegal BAC limit, I'll go into some depth on that. Implement in-vehicle alcohol detection systems. We've talked about that. That's the DAD system. Screening and brief interventions. Again, a lot of research on that it reduces binge drinking, heavy drinking, and consequences that result from heavy drinking, but very little research on whether it reduces crashes. So we need more there. But I believe in it. I think that if we actually did that in any kind of frequency, certainly in hospitals and in doctors' offices, if we did screening and brief intervention, it would have a pretty big impact. Administrative sanctions for .05. Again, I'll talk about that in a minute. Requiring interlocks for all offenders. We've talked about that, and I'll just talk about what I think the barriers are. And then increasing frequency of checkpoints. I'll do that too. So these were the top strategies voted by the experts. And administrative sanctions, interestingly, came in number 1. And I'll explain that in a minute. But as we know, Utah did pass a criminal .05. Now, whether the governor signs it or not, we'll see. But the criminal has passed. Now, however, we think it'll be much easier to get administrative. So that's why that was recommended. And then all offender interlock laws and increased frequency of checkpoints. All right. Going from '08 to '05 and impose administrative sanctions. I think you all know that the laboratory research, the crash risk research, the public surveys, and the evaluations done in Australia and Europe when they went from '08 to '05 all show that that's an effective strategy. This is the laboratory research. These are the relative risks. And everything shows that impairment and risk of a crash begin at 0.05 and up. And as Jackie mentioned, most of Europe is 0.05 or lower. Australia's been 0.05 for 30 years. It's there, and it should be done. All right, here are some of the issues. Yes, there's strong opposition by the alcohol and hospitality industry, and they're working the governor right now, I can tell you, in Utah. The cost to implement, that's been a complaint, but the cost to implement will be minimal. All you're doing is changing the limit. The same rules apply as far as stopping people and determining whether they're impaired or not. So the cost should be minimal. DWI arrests. DWI arrests did not increase when we lowered the BAC from 1.0 to 08. Matter of fact, they went down. So that's not going to happen either. So it's not going to overwhelm the system. Can it be enforced? Yes, the same rules apply. You still have to have probable cause to stop the car and so on, a reasonable suspicion and so on. Will it deter high BAC drivers? Yeah, most of the studies of 0.08 show it does affect not only drivers at low BACs, but drivers at high BACs, almost the same amount. And the reason we picked administrative is because it might be easier to sell administrative sanctions to legislatures. I think legislatures are worried that, well, this poor person who had a 0.05 had a couple of drinks and got stopped and convicted is going to have a criminal record for the rest of their lives. And maybe they'd be more apt to let this be an administrative. Most of Europe, it's administrative. 0.05 to 0.07 is administrative. They lose their license, they get fined. That's it. It's not a criminal charge. So that's probably a good way to go. And if we don't make any progress, and if we don't get federal sanctions, as Jackie suggested, then that's probably the way to go. All offender interlock laws, yes, we're trying to do that, but at best the penetration is 50% of the people who should get it. That's at best. And in a lot of states, it's 10%. And we know that once the interlock is removed, recidivism returns to the same level if they don't get treatment or something else. And one of the ways that we can counter that is by extending the interlock when they have lockouts in the last 3 months. I'll go into that. And now there have been 3 studies that show that there's a general deterrent effect, and I'm in the middle of doing one right now, so we'll see how that turns out. Overcoming the interlock barriers, increasing the penetration should increase the general deterrent effect. Once people hear about it and hear that everybody's going to get it, it should deter people from drinking and driving. But I think the way to do that is to have more severe alternatives. If the offender says, Your Honor, I don't have a car, you can't put an interlock on a car I don't have, and the judge says, okay, then we're going to put a scram device on your ankle. You're not going to be able to drink for 6 months. Now, would you rather not drink and drive with an interlock, or would you rather not drink for 6 months? You know what they'll select. And the other alternative should be house arrest. So right now, we don't have good alternatives. Offenders just say, I don't have a car, okay. And offenders say, I'm not going to drive, okay. There is a device, by the way, Smart Start was looking at it. They're one of the interlock providers. It's an ankle bracelet that detects whether you're driving or not through your the movement of your right foot. And it was developed by the military. And Smart Start has it, and we're hoping that they will develop it, because that would be the enforcement then for not driving. All right, and then use offender performance, as I said, lockouts. If they have any lockouts in the last 3 months, then it ought to be extended, the interlock, and just keep extending it until they don't have any lockouts for 3 months. Now, checkpoints. This is my favorite because This has probably the most research, the most solid research, and it would most immediately affect impaired driving, most immediately if we could do this. The latest CDC study shows that checkpoints reduce alcohol-related crashes by 9%, and the studies range from 4 to 17%. However, only 38 states actually conduct them. As JT said, 12 states don't do them. They're either illegal, prohibited, or they don't feel like doing them. 18 states say they conduct them on a weekly basis. That means they do at least one checkpoint in the state each week. All right, that's not very many if you think about it. So that's the situation right now. Now, I looked at the 12 states where they're illegal or prohibited, and in FARs and the percent. Now, I know this is not a study, but I just want to show you it's not a coincidence that the percent of drivers in fatal crashes was 25% in those states, and in the 18 that do them weekly, it was 20%. Not a coincidence. Checkpoints, well, here are the barriers. Checkpoints are prohibited in 12 states, but I think that if in any one of those states, some police agency has the intestinal fortitude to run a checkpoint, the first person who's going to get arrested, their lawyer is going to sue the agency for doing a checkpoint, and then let it get resolved in the courts, because the U.S. Supreme Court ruled that under certain conditions these are legal, and so other states, this should happen in other states. So I think that's the way we can overcome that. They complain about too many police officers needed. Baloney. We've done studies in West Virginia where we use 3 or 4 police officers. You could do them at stop signs. As long as you do them, as long as they're visible, and as long as they're publicized, they're very effective. These low resource, low manpower checkpoints were just as effective as the large productions. Police officers say, well, we don't arrest enough drivers at the checkpoints. That's not the reason for them. I was over in Australia where they do their random breath testing, where they breath test everybody that they stop. And I asked the first officer, I said, how many are you going to catch tonight? And he said, oh, that's not the idea. We're not out here to catch people. We're out here to deter people from drinking and driving. They get it. Police do understand it. When I talk to law enforcement, they do understand general deterrence, but they don't practice it. They just don't. And we have a lot of convincing to do there. Police also think that the public doesn't support checkpoints. Again, that's not true. And some think checkpoints are risky for police. How can we deal with these barriers? Task forces, coalitions, attorney general, governor to overturn checkpoint prohibition because of the Supreme Court decision. Deploy smaller checkpoints or use multi-agency cooperation. It's their general deterrent value, not the number of arrests. Use equipment, as Bob mentioned and as Jessica mentioned. Passive alcohol sensors have been around for 30 years. We have tried to convince police at least use them at checkpoints, because you only have at most 10 seconds to decide whether this person is impaired or not. And if you use the passive sensor, it will sense twice as many people as you can yourself. And so use them. We can't convince them to do it, but it would serve as a random breath test, essentially. It would be just like Australia if we had passive sensors. And can you imagine if the public found out that we had passive sensors at every checkpoint? How careful they would be when they go through one? All of our surveys show 75% of the public support weekly or monthly checkpoints. And then another percent support them less frequently. Only 6% are against them. Those are the 6% who drive drunk consistently. Checkpoints are not as risky as traffic stops. This is one thing I've been trying to get across. You know all the stuff going on now about traffic stops. They're unsafe for the person stopped. They're unsafe for police, too. There have been a lot of things going on with traffic stops. If they did less traffic stops and more checkpoints, checkpoints are safer. There are lights, there are police cars, there's a lot of safety at checkpoints that you don't have in an isolated area where someone's stopped by a police officer. So if they did less traffic stops and more checkpoints, boy, would we see a difference in impaired driving. Okay, that's it. I'm off my soapbox.
I
Some quantitative measure of the risk of checkpoints and traffic stops compared to what?
The risk of what?
That's one of the big things that you've repeated several times. That some people.
Can you use your mic, please?
So there must, I know there's a risk to catching people for speeding. How does it compare to that?
Well, they don't, as I mentioned, they don't catch a whole lot of people DWI at checkpoints, all right? About 1% of the drivers get stopped and arrested for DWI. But again, that's not the point. The point is to deter people in the first place from drinking. And oh, the risk to the officer at checkpoints? I know of none. I don't know of any checkpoints that resulted in any kind of problem. Now, maybe there were, but I haven't seen anything.
You mentioned a regular stop, though.
But a regular stop, well, there's what's been going on recently where, you know, somebody runs, an offender gets out of the car and runs, or he shoots the police officer. We've had several police officers shot after a traffic stop. Being hit by an officer in Maryland got hit by a car at a traffic stop. That doesn't happen at sobriety checkpoints. Everybody slows down because of the signs and then all the lights. You can't really have any brutality on either side because it would be witnessed by too many people. That's why I'm saying that.
Great.